Hello everybody. Today I'd like to share with you a very important video and interview with Mila and her family. As you can see from the intro video, Mila has suffered greatly in the past 8 months with uncontrollable tic that can lead to a very severe seizure. And I was fortunate to have the opportunity to treat her in the past month with simple and effective therapy that has greatly reduced her tics and pretty much eliminated her seizure activities. This video is important because California, like many other states across the country, are passing and introducing laws and regulation that prevent physicians from discussing freely of what's effective with COVID treatment and many other things. When you limit free speech, you basically limit our ability to prevent harms and providing effective therapy for people in our nation, especially in California. And without further ado, let's go ahead get started with this podcast and interview. All right. Thank you so much for joining us to have this podcast and talk about Mila and how she has unfortunately suffered from the COVID vaccination and how she has recovered. And if I can have you three introduce yourself a little bit to our audience.
Okay. I'm Shala,
Okay.
and I'm Mila's mother, former dancer, choreographer, and my daughter is a beautiful athlete and extremely intelligent and wonderful.
Okay, and Dad?
Sean, prior service and ex-law enforcement.
Awesome. Mila, would you introduce yourself to our audience real quick?
I'm Mila. I graduated early and I'm working on completing pre-med currently.
Okay. So, I would like to ask Mila to share with us what happened last year and how did you came across feeling like you had to get this vaccine and what have you experienced and what vaccine it was?
Well, so during last year, there was a lot of pressure put on all of the students of my college and at work. They mandated the vaccine and they did not offer any exceptions to getting it. I'm working on going into a field in medicine, and the classes that are required, they all have prerequisite labs that I have to attend to in person or they will not accept me. So I was not given any alternative to test or do anything else. It was either get the vaccine or not pursue a career in that field. Not only did my college mandate it, but my work that I was currently doing, the hospital I was volunteering at, and any other opportunities for experience that I needed.
So you felt like you have to get this done or you're not able to pursue your classes and study? Okay. So which vaccine did you get?
I got the Pfizer vaccine.
Okay, and do you remember approximately what date?
I got the first dose on 9/11.
9/11, okay. You did not get a second dose.
I did not.
Okay, so tell us a little bit about what happened to you. What did you experience after you got vaccinated?
Well, the very day I got vaccinated, several minutes after I passed out and 911 was called and I was rushed to the ER. Following that, I went to several specialists, several pediatricians, several different doctors, all of which who either told me it was all in my head or nothing was wrong with me. A couple of them even refused service when I mentioned that I believed it was from the vaccine.
Okay. And describe some of the symptoms. I see that you have a little bit of a tic right now. Describe some of the symptoms that you were experiencing after you got vaccinated.
Yeah, so I developed severe flu-like symptoms,
Okay.
muscle aches, things like that, which developed into tics that I currently have, seizures. I went through a period of paralysis for a while. I was unable to walk. at all. I was in a wheelchair for over a month, unable to have any feeling in my legs.
That's pretty traumatic. It's almost as if you had a spinal cord injury. My gosh, being in a wheelchair. And I've seen that video where you had to hold on to your dad going up and down the stair, and as if you were trying to learn to walk.
Good. And 4. Good. And 5.
Go get him. Go,
And
go,
6. Good. And back. Okay, so now you're going to go
Go.
right
Go get
to
it.
in
Go.
front. Okay?
Go. Good. Good
Go.
boy.
1,
Why do you
And back.
sound like you're sick, Jaden?
2. Good. And back. 3. Good. And back. 4. Good. And back.
And now that you started the treatment after you saw me about a month ago, we got you started on ivermectin and also fluvoxamine. And now that you also share with our audience that you want to go into medicine. So tell me a little bit about what I have told you, what the ivermectin is doing for you and what the fluvoxamine is doing for you as far as treating these type of symptoms.
Well, the fluvoxamine, I believe, helps manage and regulate the sporadic signals in my brain for the seizures that I'm having, and the ivermectin helps with the spike protein.
So we don't know exactly how they work, but we are thinking that the ivermectin is to help reduce spike protein toxicity on the rest of your body, especially your nervous system, and fluvoxamine crosses the blood-brain barrier and also reduce that nerve inflammation. There's a lot of things we don't know, and does not mean some physician may say, oh, just because we don't know, we don't want to treat it. Okay, and ivermectin has been pretty phenomenal in helping to treat some long COVID symptoms and treating people with actual COVID infection. And fluvoxamine has been really good in reducing the brain fog and a lot of the nerve inflammation that people suffer either after vaccine injury or after COVID infection. So, and I have found that in my practice that a combination of both has been wonderful. So I heard that you were able to ride your motorbike for the first time after treatment.
That is correct, yeah. I have had the opportunity and moments throughout the day where I'm able to become more active like I used to. I was I was training for triathlons before I got the vaccine, so I was in the best shape of my life, and I have not, I had that taken away from me.
Okay, and some people may have a question that, did you have any health issues before you were vaccinated with the COVID vaccine?
No.
So you were very healthy and you wanted to train for triathlon, you're very active, right?
Yes.
Okay. So this is definitely something new. And was there any neurological disease or disorder that runs in the family?
No.
No, okay. And you were also able to ride, on top of motorbike, you were able to ride your bicycle too, right?
That is correct.
For the first time in months.
Yes.
Okay. And is it true that you were also able to run
That
the
is
first
also
time
true.
in a couple
Yes.
months?
Very big deal.
Fantastic.
There you go. It's okay. It's okay. Take your time. Tell your left leg to move. One, two. Yep, there you go. Alright, let's head back the other way.
Okay.
You got it. Whatever your left leg wants to work. It'll be okay. Oops, yeah. There you go. There you go. You want to go to the end of this square.
Okay.
You're in a lot of too. There you go. Well, that was pretty fast. Explosive. There you go. One more. Come on. You got it. Come on. Tell that left leg. Tell that left leg. Come on. Tell that left leg. Yeah. All right. Come on. And you're done. All right. Now, I can carry you in there if you need to. Or we can just stand here. You need to be carried?
Yeah.
Okay. Mom, can you open the door?
Yep.
Rather than record?
Okay. Now, Sean, I'm going to ask you a couple questions. You have serve our country and serve our community. You protect this nation. Now, this whole pandemic with all this vaccine mandates and whatnot is supposed to protect your family, your children, and yourself from injury and harm. And seeing what these mandates had done to Mila, to your daughter, how does that make you feel of the things that you have sacrificed? Is this the way that our nation should pay you back to thank you?
I don't think that this is the way that any leadership should treat any of the people that they manage. And then with the fiduciary responsibility that the governmental leadership is supposed to have, you would naturally assume that they would take a little bit more care and precaution instead of being so reactive and let's just say less than educated on the full series of risks associated with, specifically speaking, the vaccine itself. Not to say that COVID didn't fall out of the sky and surprise a lot of people, but to not take a scientific approach to variable control and actually problem solve one at a time to try to come out with a solution that is not harmful or more harmful than the actual sickness, I think is a complete miscarriage of trust and also intellect.
What angers you the most seeing what happened to Mila? What is that one thing that really bothers you about everything that's happened in the past 7 months?
Well, it's the lack of responsibility. That would probably be the biggest thing that I have a problem with. Number one, I don't think that their decision making was correct. And then that's a complete other discussion if there's politics injected into it. But they do have clinical 1, 2s, and 3s trials for a reason, and to violate those processes that have been in place for I don't know how long, you should at least have some type of empirical data in order to support your solution. And then with that, for them to basically say that it's psychosomatic, it's in her head, there's nothing wrong with you, that's a bit of an insult to my intelligence, and especially when there's no credibility issue at hand here. Maybe you should listen to what the people are saying. And then now with all the things that are coming out, they're saying that there's no there. Well, there's sure a lot of smoke, around all these issues, and usually where there's smoke, there's fire. And this is turned into a big major problem where, the politics aside, we would like to know what data is available that could help her.
Right.
Who knows what, in what tests that they have conducted, who knows what, that maybe there's an answer. I'd rather no kids got sick. I'd rather that nobody got sick, and I'd especially rather that nobody got sick from the medicine that's supposed to help them. And then I'd really rather not have anybody go and then potentially try to hide or obfuscate, the truth, and then have people get sicker from it. There's a whole bunch of wrong wrapped up in this package.
And what do you feel about the fact that there's such a lid on information, right? We're going to cancel anyone or punish, go after physician's license that any doctors that dare to speak up about what we have tried on Mila. And there's just absolutely no discussion. And Biden has this misinformation czar that's going to go after anyone that spread misinformation. What do you think about this attack on free speech, on scientific process?
First Amendment's there for a reason, plain and simple. Seems like you got some people that just, I don't know. People are smart, and people can make their own decisions. And who's to say that these singular brains have the intellectual capacity of the millions of people that can decision make, on their own, let's just say with their own intellectual capacity, with their own problem solving. It seems like, millions of brains thinking about something's better than one. I've not seen a hall boss work too good,
All right.
and that's what they're doing.
Communism and socialism is about one person claiming that they own the truth, right?
Yeah.
One person says it's either my way or the highway, and I don't think that communist country have done very, very well. If you look at what's going on in Shanghai, China right now, the whole city is locked down because of COVID, and people are suffering greatly. And the great leap forward with Mao Zedong over at China in the 1950s and 60s, starvation was rampant, and they killed over 45 million Chinese as a result. I think when the free speech, ability to speak freely is gone, then that's when we can get into some serious trouble. Charlotte, I'm going to ask you some question. What do you feel about the fact that life insurance company have recently announced that in 2021 there is a 40% increase in working age people, 40% increase in death in working age people in America. So that's basically about 250,000 Americans have passed away in the past year. That's in the working age. So a 40% increase, let's put this in perspective. 10% increase is 1 in 200-year chance that something horrible happened. Let's say the Spanish flu or some type of horrible war. The 40% increase is unheard of. It's 1 in a billion-year chance. Okay. So how do you feel about that statistic?
It's alarming. Are you asking me this because are people getting sick, do we think? Do we know what's causing the...
It's all-cause mortality. So not just COVID, it's vaccine injury, there's like 100,000 people die of drug overdose, just basically depression, anxiety, and feeling despair.
Mm-hmm.
Yeah.
Well, I would say that information is very important to get out to everyone, and if we are in a society where freedom of speech is not being allowed to help each other, then that is a problem. That bothers me and relates to my daughter, because if we would have had access to information early on, perhaps she wouldn't be where we are today.
Right. Yeah. And Charlotte, Mila, the pandemic is over. When Omicron came, it's a natural vaccination. So more than 75% of children younger than age 18 have all had COVID. And Biden administration, not to say that they are the one that's creating all the issues, because this vaccine got started with the Trump administration. But the Biden administration are proposing a $22 billion budget to come out with the next COVID vaccine, to come out with more testing requirement in school. What do you think about what we're doing and what we're using this money? And how do you feel about that there could be more mandate coming down the pipeline, even though the pandemic is over and pretty much everyone has natural immunity?
Well, in order to propose something like a brand new vaccine or another booster, I would like it studied, to have an idea of how big the risk would actually be.
Okay. So you don't want people to potentially suffer what you went through, right?
Absolutely not. If there's risk associated with whatever we are putting into our bodies, whatever the thing is, we should at least be educated on what could happen.
Okay. So you may become a physician in the next 5-10 years. You may become some sort of health provider. So I will need you to take care of me when I get sick, and we will need to depend on you to take care of your parents and the community. What's your thought about what you went through in the past 7 months, and what do you see yourself as a healthcare provider, knowing what you know now?
Well, I want to succeed where others have failed. I have been told that I am crazy simply because the vaccine did this to me. Over a dozen doctors have not even considered the possibility that it could be done, that this vaccine could do this damage. I would like to, if a problem is presented with me, I'm not going to simply brush it aside. I want to research it, and I want to actually help people, despite the political climate associated with such thing.
There are policy now that are going to take license away if you dare to say that the vaccine is not safe and effective. For example, like my license. Can you imagine if my license were taken away before you had a chance to see me? Can you imagine if your license in the future, if you're trying to do the right thing and treat your patients, that let's say if you go to Oregon or Washington State to practice, or stay here in California to practice, that the state is going to tell you how to practice medicine. How do you feel about that?
There is no one way to practice medicine, and things should not be limited just because of politics. You shouldn't not treat someone simply because they say it's not possible, that it could be caused by that. Look into where the root cause is. You know, there's critical thinking associated with treating anyone.
Okay. It has been an ordeal for your family, for Mila, to go through this in the past 7 to 8 months. What is this one thing that you would like everybody to know, those people that are watching this video? And I'm gonna put the video in where it shows that Mila was suffering from a seizure. And you can see the difference, even though Mila still has some tics and she's able to ride her motorbikes and able to run. So there's tremendous improvement, and this is still a work in progress.
Yes.
What is this, something that you'd like to share with our audience with what 3 of you have went through in the past 7 to 8 months? And we'll start with you, Shauna.
I would like the audience to know that doctors like Dr. Huang are very important. We need to fight for doctors who are about treatment and not about worrying if they're going to have their license taken away. Early treatment is extremely important, and I'm very, very upset with the numerous doctors and professionals supposedly and specialists who have seen my daughter. We have gone through the rigmarole of each specialist. She has had nerve pain, she has had muscle pain, she has had, you know, these types of fevers and etc. And all they could do is just send us around to each physician or each specialist because they were afraid to do their job. They took an oath to take care of people, to take care of patients. And I appreciate your bravery, and I appreciate just seeing a doctor who's willing to stand up for what a doctor is supposed to be about. You know, treating people requires just that, treatment. And to allow any government to tell you how to do your job is incorrect. So to everybody who's watching today, I strongly recommend that you look at this video, contact Dr. Huang, and also there are other doctors that I'm sure you're aware of who are in a network. And the problem is the cancel culture. The problem is misinformation. There is no misinformation here. My daughter has been injured. It's obvious. So doctors need to do their jobs, and if they are not stand-up doctors, they should not be practicing. All doctors should come together and put pressure on the hospitals, on the bureaucracy, and demand that they be allowed to do their job. And I want all these parents out there to be aware of the fact that you need to look past things that are being sold to you as being safe, because there's nothing that's safe. Everything has risk. But I strongly recommend that they take this information and utilize it. Early treatment is key.
And Sean, your thought?
I would say that you cannot put doctors on a pedestal any longer and just take their word as gospel. You know, you need to ask questions. You need to, like my wife said, attempt to hold them accountable. And you have to realize that our experience is the doctors are just simply relying on a line and block chart for their decision making. They have no capacity of independent thought. They're just going to rely upon some standardized testing, and they have no ability to go out there and conduct any research. And that's just based upon our own personal experience. I'm sure there are other doctors out there doing great things, but you know, the fact remains is that if you're going to sit there and take the accolade, and you're going to take the title, and then you're not going to live up to the standards that's set forth in terms of decision making, you guys should really be ashamed of yourself. And as parents, you have to realize that you need to question the doctors, and you need to question what they're doing, and you need to go to that thing called the internet, and you need to do some research on your own so that you can see if basically the wool's being pulled over your eyes by these guys with these lofty titles and, you know, expensive cars, are over there just feeding you a bunch of bull because of the politics that have permeated their organization. And if that's the case, those are the ones that shouldn't be practicing medicine. Shouldn't be guys like you. Guys like you should be practicing medicine because you're out there trying to solve a problem. You know, we don't need people that are just going to rely upon a line and block chart, and if you don't fit in their little cookie cutter filter, then you're ass out, and then you're just going to be the one that remains sick, and they'll just treat you as you get further along, and you're just a number. Who cares? You know, that stuff's got to end. This is not corporate accounting. These are people's lives, and each person has a quality of life that they want to achieve the highest quality of life that they possibly can. And as doctors, you know, and as people, we should be trying to give that to those people. You know, and Mila got, you know, she got the short end of the stick on all of this. Nobody really tried to help her out. They just wanted to help themselves out. You know, they didn't want to get in trouble. You know, oh, okay. So I'm gonna understand a guy that just recently got out of med school, and he's got $600,000 in debt and all that. I get it. But when you're pushing 60, got a couple mil in the bank in a country club, like really, you can't buck the system. So basically, you went along with the process for all those years, and you got the money in the bank now, and now you can't man up and push back against the system to do what's right? You need to check where your character is, because obviously you don't have any.
And Mila.
Unfortunately, I'm not cognitively able to answer any further questions at the moment.
Sure. It's a little bit hard and stressful on you, I understand. And thank you so much for hanging there with us. And I have faith that you're going to continue to progress and get better. And I really appreciate all of you spending time and share your thoughts and your feeling about this whole thing. And we need to protect everybody in our nation and across the world. We need to get the information out. Ivermectin and fluoxetine. Amongst there could be many other drugs that's effective. We need to have that ability to discuss, and there should never be a lid on this about information. Okay.
Agreed.
Thank you very much.
Thank you.
Mila and family, I'd like to thank you from the bottom of my heart to allow us to have this ability to listen to your story and to see how you have suffered and now going through recovery with this simple yet straightforward treatment therapies. These videos are not designed to give anyone individual treatment recommendations, but as an example to show you that there are ways that we can treat COVID vaccine injuries. And it is very important for everyone in the nation, especially healthcare provider, to know that there are ways to treat COVID injuries and that we need to act and listen to the patient. That if they are suffering from certain symptoms that's not in the standard medical textbook, that we need to listen to them. These vaccine injuries are very, very new. I did not know how to treat these vaccine injuries. I learned as I go, as patient presented to me, that we need to exercise our critical thinking to help people get better and not suffer. So last night I was at a fundraiser event for frontline worker and firefighter that have lost their job because they refuse to be vaccinated. Majority and pretty much every one of these frontline workers already had natural immunity, and they chose not to be vaccinated, but they lost their job. Their employer had decided to did the unthinkable and basically fire them illegally. And I share your story, Mila, your story of vaccine injury and recovery to them. And every one of them are extremely supportive, and they all want you to get well and get better. I just want to let you know that. We need to stand up. In the past 2 years, the nation has suffered enough. There are 40% increase in death amongst the working class people. That's about 250,000. And I say enough is enough. We need to stop the government from passing bills that prevents us from talking freely amongst each other. If we find a medicine that works for a certain disease that we don't understand, and if it doesn't cause any harm, we should be able to use it. And at the fundraiser meeting, there's an auction to support the firefighter and the frontline worker. Support them because they don't have a job anymore, so they can continue to pay their bill. And I was fortunate to have bought a surfboard, and I asked everyone to sign the surfboard as a way of showing that we want to live free, and we want to be happy, and we don't want to be harmed. As the Hawaiian saying goes, noho kuakoa pomekai, live free and prosper. And every one of us should have that ability to live free and prosper, and to understand that as Americans, that we have the protection from the Constitution and protection from the Bill of Rights, that we have the choice and make decision, and not to have things done to us that can hurt our health and our body. Last week, I had the opportunity to go to Sacramento, to the Assembly Hall, to testify as an expert witness against the bill that are going to go after physicians for quote-unquote spreading false information about COVID-19. And it's amazing to think that somebody somewhere knows the truth about COVID-19, that things is not going to evolve and change. Just like any topic in any aspect of medicine and science, we need to continue to learn and discuss, and not inhibit and prevent physicians from discussing and try out things until we know what are the best things to do for a certain type of disease, not just COVID-19. And when I got to the Assembly Hall and walking to the assembly, I felt a sense of sadness that came over me, because I felt like I just walked into a Communist Party meeting. All the politicians were sitting up there in their chairs, looking down on us. And many of them got their face covered, and I don't know who they are. And they're basically passing bill after bills that I don't even know what they stands for. In California, I already have over close to 400,000 laws and regulations that govern the state, which is about 3 to 4 times more than any other state in our union. What does this mean? We are basically reaching and already past the saturation point that any laws and regulation that we're passing now just making our life impossible. When is enough? How many laws do we need to pass and say, wow, we got to put a stop to this? Is 500,000 enough? How about 1 million? Why not make it 2 once we pass that 1 million mark? To the point that we're not able to wake up in the morning and go to work without violating 10, 20 laws and regulations to the point that we cannot get anything done? Are we going to get to the point where nobody want to live in California because it's impossible to practice medicine, impossible to live our life, impossible to go to school without getting harmed and getting regulated? There's a song back in the 80s, we built a city on rock and roll, and they were singing and talking about the city of San Francisco. It's no longer the city that we built on rock and roll, where we can live free and be happy. It is a city that's built on mandate and building on harassment. It's built on regulation that doesn't work, that we do not enforce the law. The city are filled with homeless people and filled with lawlessness. This is not the path that we want to take. And this is the reason I decided to go into politics. I decided to run as a California State Senator. I would like to get into Sacramento to help put a stop to all this madness and say enough is enough. We need to protect all citizens' liberty and freedom. And passing more laws and regulation that doesn't make sense is nothing but a pure destruction of our freedom and of our liberty. And I would like to encourage all of you listeners out there, every one of you should get involved with your local government, get involved with politics, run for school board, run for as your city mayor, run as your local assemblyman and senator. We need 50, 100, 1,000 of you people out there that have the love of liberty and freedom to go into your government and change things, because we are on a very, very dangerous trajectory that are going to hurt our kids and our family. Because if we don't do this now, 20, 30, 40 years down the road, when you and I are not here, and our kids will be at this same position, running for office, trying to make their life better. Trying to make their life better so they don't have to pay for gas that costs $30, $40, $50 per gallon. Trying to make their life better so they can buy food and have their kids go to school and get a quality education without getting harmed and forced to have medical procedure done on them that's going to hurt them. So I'd like to encourage every one of you out there that's listening to be brave, to protect yourself and protect your children, and to let physicians and everyone out there with trades and special skill to practice your skill to the best of ability to make this country strong. And thank you very much for listening.